Olivia, we're going to check your back. Yeah. You can sit up here for me. That's it. So we're just going to check that all the little bones in your back are aligned properly. And if they're not, we're going to be able to fix them really easily and really gently to make you feel much better. So we always check your back about once a month, don't we, Olivia, just to make sure everything's okay. Sometimes there are some little issues. There's a little bit of tightness in the neck here and a little bit stiff in the middle of the back. Can you lie on your tummy for me? That's it. Check your pelvis. Check your hips are straight. So the sacrum, which is the little bone at the bottom of the spine, is slightly backwards on the left. So what we're going to do is just use this clicky gun here, Olivia. Just going to make a clicky noise. So this is called the Activator. This is a very gentle but very effective way to adjust the joints in little ones. Does that feel nice? That's it. A little push in as well. That's it. Brilliant. Perfect. So let's clear out this little bit of tightness in your mid-back. Again, we can use the Activator on this. So with the Activator, just feel a little bit of pressure. There's certainly no pain with it. Does that feel okay? You're doing really well. You've been a star. So I'm just going to put a little push in here as well. That's it. Perfect. Can you turn over for me, Olivia? You star. So her atlas bone, which is the top bone in the neck, is slightly out on the left side. You won't fall. Daddy's got you, hasn't he? So just going to do a gentle adjustment on this. This is called suction hold, where I literally apply some very gentle pressure onto the vertebra until I feel it release. And when it releases, I know it's aligned properly. It's starting to release already. Does that feel funny? Let's just check the rest. So I'll use the Activator on that in a second as well. Just check the cranial bones. I've had a few issues with a couple of the cranial bones in the past. Just want to make sure they're all doing well. Just a little release of her right temporal bone. Just a little bit tight. Just help the ears drain properly. Left one's fine. That's all fine. Can you give me your arms, please? Reaching really high. That's it. Really tall. Wow. Check the little muscles in the front of the hips. They're okay. Come and sit up for me, Olivia. That's it. Just bring your leg around this way. So I'm just going to check your neck now, Olivia, okay? Just look straight forwards for me. That's it. Okay, a little click here. That's it. It's okay. Just one more. That's it. Good job. All done. High five. What a start.